Okay, let's dive right in. We've all heard the buzz about AI in healthcare, but what does it actually mean for us, for the patients? We're going to look at the incredible promise AI holds for fixing a system that's, well, seriously strained. But we're also going to get real about the major risks and the crisis of trust we have to solve before we can comfortably hand over our health to an algorithm.
4 months. In some countries, that's how long you might have to wait for a specialist appointment. I mean, just think about that. For some, it's an inconvenience. But if you're a cardiac patient, a delay like that can literally be the difference between life and death.
You look at the numbers and it's hard to argue otherwise. We've got these staggering wait times, clinicians burning out left and right, and we're staring down a projected shortfall of 11 million health workers by 2030. The system is just under so much strain that more than a quarter of patients actually end up in the hospital simply because they had to wait too long for care.
And what's fueling all this pressure? Well, a huge part of it comes down to this number, 23 days. That's how much time a single healthcare professional loses every single year just chasing down patient data. That's almost a full month of their time that could have been spent with patients, just gone.
So what happens if we just do nothing? The consequences are pretty alarming. Almost half of all clinicians are worried they're missing early diagnoses because they're so bogged down with admin work. The burnout is real, and those patient backlogs, they're just going to get worse. So what's the treatment for this incredibly sick system?
Well, this is where a lot of experts are pointing to artificial intelligence. They see it as a revolutionary solution, something that could fundamentally change the way we do healthcare.
And the promise here is just enormous. I mean, imagine an AI that can analyze medical scans with superhuman speed and accuracy, or one that suggests treatments based on your unique genetic makeup, and, at the same time, automates all that paperwork we were just talking about. The real goal is to free up our doctors and nurses to do the one thing an AI can't, actually focus on their patients.
And this quote, wow, it really captures the scale of the ambition here. We're not talking about making things a little bit better. The vision is to potentially double the number of patients that can be cared for by having AI work as a true partner, right alongside clinicians.
But just as we're getting sold on this incredible futuristic promise, we hit a massive roadblock. And that roadblock is a huge gap in trust between the people building these tools and, well, us, the people they're supposed to help.
And here's where the problem really starts to show. A recent global survey found this massive 34-point gap. Clinicians, they're pretty optimistic about AI's benefits, but patients, especially anyone over 45, are way more skeptical. There's a real disconnect.
And get this, it's not just the patients. A survey of hospital executives, the people in charge, show that only 13% of them even have a clear strategy for AI. Even worse, just 12% think the algorithms are strong enough to be relied on. So even the leadership isn't fully confident in the tech yet.
So building that trust really boils down to a few key things: being transparent, proving the models work, and involving clinicians from the very beginning. But this trust gap isn't just about feelings. It's rooted in some very real and very scary dangers.
Because beyond the trust issue, there are some critical risks that we have to confront head-on. Everything from biased algorithms to brand new kinds of security threats. First up is algorithmic bias. And it's a pretty simple concept, really. If you train an AI on data that only represents one group of people, its brilliant insights might completely fail everyone else. Instead of fixing inequality in healthcare, a biased AI could actually make it way, way worse. And this isn't just a what-if scenario. It's already happening. Studies have shown that some AI models designed to spot skin cancer are less accurate for patients with darker skin. Why? Simple. They weren't trained on enough diverse data. Then you've got cybersecurity. Every single one of these connected devices, insulin pumps, pacemakers, even MRI machines, is a potential backdoor for a hacker. And an attack here isn't about stealing your credit card info. It's about changing how a device actually works, which could directly, physically harm a patient.
And, there's even a risk to the doctors themselves. Educators are worried about de-skilling, where experienced doctors start to lose their critical thinking skills because they rely too much on AI. Even scarier is misskilling, where a trainee actually learns the wrong way to do something from a flawed AI. Or never skilling, where they just fail to develop those core skills in the first place.
Okay, so with all these risks, how in the world do we move forward? Well, the solution isn't to just give up on AI. It's to build a much smarter, much safer partnership between the human and the machine.
So, to stop that de-skilling problem, new educational models like this DEFT AI framework are popping up. It's a whole process. It starts by diagnosing how a trainee is using AI, then teaches them to evaluate the evidence it spits out. From there, instructors can give targeted feedback and teach them crucial skills, like how to spot bias. It's all about guiding them toward using this tech responsibly.
Clinicians are also learning to think about working with AI in two different ways. You've got the centaur mode, where the doctor is clearly in charge, just handing off simple tasks. Then there's cyborg mode, where the human and AI are working together much more closely. The trick is knowing which mode to be in and when, and always operating with a verify, then trust mindset. And of course, the regulators are stepping in. The UK, for instance, has laid out these 5 core principles for any AI used in healthcare. Basically, it has to be safe, transparent, fair, and accountable. These are the guardrails that are meant to let innovation happen, but without ever risking patient safety.
Which brings us to the biggest, messiest question of all. We all agree, AI is a tool, it's not going to replace your doctor. But what happens when that tool makes a mistake? Who's liable? Is it the doctor who used it? The hospital that bought it? The tech company that built it? Answering that question is the next great challenge, and honestly, it might be the biggest hurdle of them all.